On the afternoon of Tuesday, August 6, 2024, Montgomery County Fire and Rescue crews from Station 29, 34, and 35 and EMS Duty Officer 703 were dispatched to a giant grocery store in Germantown for a patient in cardiac arrest. The crews arrived and found the patient lying unconscious in the aisle of the store with bystander CPR in progress. Witnesses stated that the patient was shopping when he collapsed. The fall was witnessed by Lynna Gaskins, a registered nurse at Suburban Hospital. Lynna approached the patient and noticed that he was pale and appeared to be very weak. Lynna was concerned that the patient had experienced a near-syncopal episode and recommended that the patient be transported to the hospital for evaluation. As Lynna and the patient were conversing, the patient became unresponsive with agonal respirations. Lynna rolled the patient onto his back and initiated CPR. The store's pharmacist retrieved the AED located in the store, and an employee called 911 to request assistance to the scene. Together, they applied the AED pads and analyzed the rhythm. A shock was advised, so the crew defibrillated the patient and continued chest compressions. At this time, the BLS crew from Engine 734 arrived on the scene. They resumed high-performance CPR and assisted ventilations with bag valve mask. At the next two rhythm checks, the AED advised the crew to deliver shocks, so the patient was defibrillated a second time and a third time. At this time, crews from Station 29 and 35 and EMS 703 arrived on scene to provide ALS care. The patient was placed on the cardiac monitor and vascular access was obtained with an IO. At the fourth pulse check, he was found to have return of spontaneous circulation with strong, palpable carotid and radial pulses present. A 12-lead EKG was obtained. The patient had a sinus rhythm with ST depressions noted in several leads. As the crews worked together to obtain vitals, the patient began to regain consciousness. As the patient was packaged and moved to the EMS unit to prepare for transport, he became alert and oriented and was able to converse with EMS crews. En route to the hospital, the crew administered an amiodarone drip, performed serial 12-lead EKGs, and continued to monitor the patient condition and vitals, and consulted with Shady Grove Medical Center. Upon arrival at Shady Grove, patient care was transferred to waiting emergency department staff. The patient was stabilized in the emergency department before being admitted for treatment and evaluation. The patient was later transferred to Suburban Hospital for further treatment and interventions. The chain of survival is integral in increasing the patient's chance of survival in the event of sudden cardiac arrest. Thanks to Gaskins for recognizing the patient was experiencing a medical emergency early, activation of 911 to use the public AED, excellent bystander CPR, the knowledge and skills from MCFRS crews on the scene, and the care from the staff at Shady Grove Medical Center and Suburban Hospital, the patient was discharged to home, neurologically intact, to his grateful family on August 14, 2024. Montgomery County Fire and Rescue Service is proud to recognize the personnel for their dedication, professionalism, and teamwork. Thank you.